topic actually is COVID-19 new hotspots in remote US, mostly in the rural and farm working communities in the US. Now, this is a bit of a different tangent here based on epidemiology standpoint, but then also from the new emerging viruses which is emerging and spreading new infection rates in areas which we haven't thought earlier. I work at Shasta Cascade Health Centers, which is a federally qualified health centers. It's just a backdrop to give you an idea where I'm coming from. And we serve rural patients in California, primary farm workers, farm working communities, remote patients, underserved, uninsured, Medicaid patients. So the PowerPoint presentation is coming from that point of view. There are about 60 million Americans who are living in the rural US currently, and that has started a new phase of pandemic starting May of this year. Most of that infections are coming from meat processing plant. The workers who are working there in the meat
the slide view. Right now it's very small.
Is it better now?
No.
Sorry.
No, not yet. Yes, now. Yes, good. Thank you.
Better now? All right, awesome. Okay. So there are about 60 million Americans who are living in the rural US. Most of them are farm workers or factory workers. And that has started a new phase of pandemic now here with those people who are poor residents, poor rural residents that now have become the new hotspots for the infection and spread of the infection. Most of them work in meat processing plant. A lot of them are factory workers. They are seasonal farm workers, and they are the ones that are now increasing the hospital bed capacity in rural hospitals and rural nursing homes. Rather than as equally, or I would say not even less than, but maybe equally as compared to the urban counterparts. There are out of 25 rural counties with the highest per capita case, 20 have been from the meat packing plant. And that includes most of the rural counties in the US. Those people working in those meat packing plant or the prisons where the virus took hold and then spread with the men and then kind of leaped into the community when the farm workers or the factory workers went to their homes. The reason for that again is because working in those meat packing plants, it's a low temperature, chill temperature. It's a good environment for the virus to spread. Poor sanitation standards also add to that, to the spread of the virus and to the growth and infection rates of the virus. As per CDC data in June, which is the last week of June, there have been 5,000 cases in the workers at almost over 100 meat plants, meat processing and poultry plants in 19 states in the US, and most of them are again coming from farmlands or rural and remote areas. 86% of rural counties had at least one COVID-19 case. 1/3 of the rural counties had at least one COVID death. This is a very recent data starting first week of July itself. Then there have been surge in new cases, infections in rural migrant farm working communities. It's very alarming for us because those are the communities which are anyhow poor. They have no access to healthcare, have no insurances, and they live far away from any nursing home or for that matter, any rural hospital. Most of those people already have other comorbid health conditions. Diabetes, hypertension, obesity is much more common in rural patient population as compared to their urban counterparts. And then on top of that, there is a huge need of increasing the capacity for the beds in the rural hospitals or in the skilled nursing homes located in the rural counties in America. There have been about 2,000 rural hospitals in the US. 2/3 of them have 25 or fewer inpatient beds available, and more than 50% of those rural hospitals are already operating in the red. They are about to close their operations because of no revenues, so that adds to the problem here. Poor housing and hygiene, another to top it off. Rural immigrant farm workers, they already live in poor housing. The hygienic standards are below standard conditions. That's again a very perfect environment for the virus to thrive and spread the infection and the transmission rates. And then it's important that migrant farm workers should be looking very carefully by the government here and the public health department if we really want to bend the curve. I think not a lot of attention has been paid by the public health agencies or the government, especially in the US, in towards migrant farm working communities or farm workers or factory workers or people living in rural and remote areas at all at this point in time. That is the reason that it's becoming a new hotspot of infection now. Most of the farm workers in rural US live in California, Texas, Idaho, Florida. Those are the one of the largest states in the US, and those are mostly migratory seasonal farm workers. And from seasonal farm working standpoint, that has become a new line of spread of infection. Migratory farm workers are those farm workers which are traveling. They are seasonal. They travel from one county to another county, one state to another state, based on the harvest season of the crops. So now it's very difficult when the infection spreads from them or they become the host of the infection because there's zero contact tracing rate. The public health department is almost unable to contact trace those seasonal farm workers, because every month or every 2 months or every quarter they are traveling from one state to another in search of jobs or for the harvest season. You can't even quarantine those patients because number one, you can't contact trace them. So how would you know if they have the infection, or how would you quarantine those patients? And then there's a huge lack of COVID testing in rural US. Where I work, we have no almost 50% lack of testing kits provided to us. Poor access to preventive care also lack of public health support. And then farm workers, mostly in the US, they lack health insurances. They are anyhow very poor. Sorry, most of them are undocumented, and they could be immigrants, either from Latin America, Mexico, or elsewhere. And so they are actually trying to make their both ends meet, help their families. So because of lack of health insurance, lack of their paperwork, lack of immigration standpoint, they are super afraid to go to any clinic or any public health department for the for a basic testing or a checkup, because they fear that if they go into a public health department or a clinic like ours for a testing, they might get deported, or they might be told to not work, papers might be taken away. So that's a huge fear factor in agricultural farm workers of actually going for a testing. Another thing is that they're unable to speak English, so sometimes that's another barrier to care there. Child labor is huge in farm working communities in the US, and when those children work with the parents who are infected, they are also getting or kind of getting themselves exposed to getting those new infection rates. So all in all, the transmission rates and death rates are increasing. There's a huge spike since June and in rural farm working communities. Right now, the government or the public health departments do not really have a great plan or any action plan for that matter on how to flatten the curve there, because most of the attention is paid to the urban communities or people living in big cities rather than people who are farm workers or especially seasonal farm workers. So I do suggest that the government could work on that. But that's that from my end. It's a pretty short and crisp presentation. Would be open to answer any questions if you have.